basically a very unsettled life, dependent obviously on alcohol because I couldn't manage life as it was.
It was the way I learned how to cope with things. When I found life difficult, I turned to drink.
I always felt like there was something missing in my life, like I didn't fit in. I felt like heroin gave me confidence.
The Department of Health Working Together for Change programme focuses on working with local frontline services, the people who fund those services, and most importantly the local people who use and work for these services. The aim is to capture aspirations and needs from today's society. As an organisation, Staffordshire County Council were keen to be a part of this programme and opted to focus on services for people with substance misuse and mental health issues.
Key to tackling drugs and alcohol addiction in Staffordshire is the third sector. The County Council have worked closely with the Department of Health to build capacity to make sure that voluntary sector organisations who are close to the community are really playing their part, their unique part, in helping people to change their lives.
We're a drug and alcohol rehabilitation centre and we provide a seamless service from detoxification through to abstinence-based rehabilitation, providing a residential setting. I think when I think about people that come into our service, when they walk through the door, they're broken. Their lives have been destroyed by drugs and alcohol. And I believe that we're able to end that dependency and give them an exit route back to a life of freedom from addiction. I think when I first heard about it, I thought, well, I don't really know what we're going to get out of it. But as we were asked by our commissioner, I thought, well, we'll go along and we'll have a look at what it's about. Key things that stood out, and I have to say more so from the service users than from myself as a staff member, was that outside interests were important to them. Following the series of meetings, we called a group of service users together. What we've managed to achieve in about 6 months has been phenomenal.
My name's Mel, I'm 39 years old, I'm a recovering heroin addict. I first started taking heroin when I went to prison at age 15. Little did I know that 24 years later I'd still be a heroin addict.
From week 6 we got asked to go to a conference about working for change.
Those already accessing the Burton Addiction Centre and completed the rehabilitation programme formed a group called FREE, meaning Fun in Recovery Equals Enjoyment, and decided to take an approach which would support and assist others coming into the system. This newly formed group felt that people who have experienced drug and alcohol problems would be the best people to help others rebuild their lives.
We had the opportunity as well to actually make a decision over what could perhaps improve the programme here, improve the lives of the people that we were hoping to help here as well. And from that, developed the idea of having an activity programme.
To help recovering addicts, not only going through the programme, when they've left the programme, because a lot of people, including myself, you need help, you can't just do this on your own.
You can't just go back into the community and just have no structure whatsoever. You need to have social skills, and because when you're in addiction all we ever talk about is drugs and crime and prison and just all the chaotic things. It's it'll just be a great opportunity. At first I didn't think I was good enough because my self-esteem was still really low, but it's been amazing to be offered an opportunity in a position like that.
But this programme and doing what I've done through everybody else in the council and here has given me the confidence to actually open my mouth now. People do want to listen.
It's given me the realisation that I can still do things. I have got the ability to make a difference still.
I'm working in a school now as well, which got loads of kids running around and everything, but I would never have gone near them. I'd never have gone near the place last year.
While they're in the house, what we're hoping to do is to have some activities in-house. So while they're residential, then they can start being introduced to things before they actually leave the programmes.
Joint activities, so nobody's on their own. We're going to go temping bowling, we're going to do other rock climbing, even if it's just a games night in the house. We just want people together.
There'll be different things from house activities to just playing Wii games, doing a karaoke, because that'll help boost people's confidence, and arts and craft. I mean, we're even going to got plans to go camping 2 or 3 days at a time. Get everybody together, who all know how everybody else is feeling. Just to say, look, you're having a bad day, it doesn't matter.
you're allowed to have a bad day.
You know, recovery isn't all about sort of gloom and doom and struggling from day to day. It's about enjoying life again, and that's the whole point of it, really.
For people's self-esteem and for the confidence, and just to get them out there and doing activities and mixing in the community. And
it's actually been the service user group that have done most of the work. They've done the research, they've found out what people want, they've helped to build a mentoring programme. They've just been phenomenal, and what it's done for me is it's helped me to realise that actually the skills that they have and the assets that they bring to this organisation and what people are going to have in the future now is the chance to actually have a social life, to be able to keep coming back and engage with the service, and that in turn then gives people who are new to the service something to aim for. They can see that there is a life after drugs and alcohol, and it's something that I certainly see continuing for longer term, really.